What's the world's deadliest animal? Sharks may haunt your dreams, but they don't come close to the mosquito's vicious bite. That's partially because some mosquitoes spread malaria, a disease that killed around 600,000 people in 2024. Shark fatalities weren't even in the double digits, if you're keeping count. So how do we stop the mosquito? Or perhaps a better question is, how do we stop malaria? This isn't a new problem. The parasite that causes malaria was first discovered over 120 years ago. It has been a persistent scourge despite over 140 attempts to create an effective malaria vaccine. However, this is the story of how international scientists came together and made a huge leap in the battle to beat malaria. From GBH in Boston, this is Nova Remix. I'm Caitlin Sachs. Our story starts with the RTSS vaccine, the first malaria vaccine. Dr. Ali Elatu, a clinical research scientist, studied the efficacy of RTSS.
I've had privilege to work on RTSS malaria vaccine, and the overall efficacy of RTSS is about 40% against clinical disease. 40% may sound as not very good efficacy, but you have to think about the burden of malaria. We have well over 600,000 deaths annually.
When we talk about vaccine efficacy, it's important to be clear about what that metric actually means. When Elatu said RTSS had an efficacy of around 40% against clinical disease, it means a study was conducted that compared a group of people who received the vaccine against a group of people who did not. In that study, the RTSS group had approximately 40% fewer malaria cases compared to the other group. Malaria is particularly deadly for young children. Their immune systems are underdeveloped and can't effectively stop the parasites. Internally, these parasites destroy red blood cells, and outwardly, patients show extreme flu symptoms like fever, fatigue, nausea, seizure, and death. Given malaria's threat, 40% efficacy was welcome support against the disease. But the World Health Organization wanted to do better and set a new goal of 75% efficacy by 2030. In England, scientists at Oxford rose to the challenge and set out to create a new vaccine. Enter R21.
R21 was born out of the idea that perhaps we could make a slightly better version of RTSS.
That's Dr. Katie Ewer, one of the scientists who set out to improve RTSS with a new vaccine, R21. These names are confusing. So for clarity here, I'll call RTSS the legacy vaccine and R21 the new vaccine. But in order to talk about any malaria vaccine, we have to know how malaria works and how to fight it.
When the mosquito bites, it injects into that child small parasites. These spend a very few minutes in the blood and then quickly go and start to multiply within the liver. From the liver, within a few days, you could have thousands and thousands of the parasite released into the blood. They attack our red blood cells, destroying them.
Now, when an intruder like a parasite invades our body, our immune system will normally try to attack it, creating little molecules called antibodies that can latch onto the invader and stop it from doing all its destructive stuff.
When people are infected with malaria, they make antibodies in the blood that stick to the outside of the parasite. They're meant to stop it in its tracks before they can reach the liver. But in a natural infection, there just aren't enough antibodies.
That's Dr. Adrian Hill, who led the Oxford team. Like he said, malaria moves fast, and our bodies don't produce antibodies quickly enough to stop it.
There's about a half-hour to 2-hour window before the parasites invade the cells in your body and set up infection there.
What we need are large amounts of very specific antibodies that bind as tightly as possible to the circumsporozoite protein. Then we should be able to stop the parasites.
You're probably wondering, what the heck is a circumsporozoite protein? Circumsporozoite protein, or CSP, is a protein that malaria uses as a key to unlock and invade our liver cells. Our bodies recognize CSP as an unwanted invader. So When our immune system detects it, a flood of antibodies attack it, covering the malaria parasite in an attempt to kill it. But the malaria parasites multiply too quickly, and our immune system loses the race. And that's where a vaccine could help. It teaches our immune system how to prepare for an infection and produce antibodies before the infection occurs. RTSS, the legacy vaccine, designed in 1987, was already doing this with some success. It contained harmless fragments of the CSP protein. These fragments were close enough to the real thing for an immune system to develop defenses. Then, when the real parasite shows up, the immune system will recognize the CSP protein and be able to attack it more quickly and in greater numbers than if it had never seen the protein before. So why wasn't RTSS, the legacy vaccine, enough? The legacy vaccine featured less than a quarter of the CSP protein across each particle. Kat Collins, a PhD student working on the new vaccine, wondered if increasing the presence of CSP would make a better vaccine. It's a simple idea. More CSP should mean more antibodies. But going from concept to chemical is a lot easier said than done.
We kept on trying different ways to get that to form into a particle, and it didn't work. It didn't work, and it didn't work. And eventually, after many tweaks and changes, it did. And we thought, fantastic, we immunized mice, and guess what? They were nearly all protected very well. This was 2012. We were finally getting there. And of course, getting there means you're ready to try and manufacture and go into the clinic.
Hill and the Oxford team were right. By increasing the presence of CSP, they created a stronger immune response, which meant a new vaccine was born, R21. Of course, the next step would be manufacturing a small amount and testing it with people in a clinic.
The 10th of November 2015, 85 vials certified. 3 doses per person, 20 to 30 people that would cover. Not exactly vaccinating the world, is it? But it's where we started.
With these precious few doses of the new vaccine, the Oxford team began small-scale human trials. They injected only 28 healthy adults and reported an antibody response comparable to the legacy vaccine at a much lower dose, which by itself was good news. Next, they purposely exposed a few vaccinated people to infectious mosquitoes in what's known as a malaria challenge trial, and found that they were protected from malaria. But this wasn't the end of the story, of course. Not yet. This was an important proof of concept. But remember, vaccine development is a very long road. Human lives are at stake, and there is no room for error. While vaccines utilize our body's natural ability to produce antibodies, we have to be sure that they're safe. To do this, vaccines are tested in larger and larger trials. As the vaccine is studied over time, scientists are able to monitor participants for unwanted symptoms. The Oxford team had tested fewer than 30 adults. For the new vaccine to be considered safe, they would need much more data, and that would mean manufacturing it at a much larger scale. The Oxford team needed some help.
Normally we go begging to companies, asking them to work with us. Word got around, and we academics talk at meetings, and you never know who's in the room, but my guess is there was somebody from the Serum Institute of India, and the next month, Umesh Shaligram turned up here wanting to talk about malaria.
Certainly, Oxford data was very convincing, early data. So that certainly made a big difference in our conviction. We made a kind of a handshake deal that we could manufacture the product. That's how the whole thing started.
The Serum Institute of India is the largest vaccine manufacturer in the world. 2/3 of all babies born globally get at least one of Serum's childhood vaccines. For CEO Adar Poonawalla, the new vaccine's potential was all about scale.
Every time we look at a vaccine, the way we look at it is that unless we can make hundreds of millions of doses for the whole world, and unless it has that need and demand, we don't get into it. These are very large populations, so they need a lot of vaccines. It would be unimaginable if they had to pay $10, $20 for a vaccine. They wouldn't be able to afford it.
In 2017, Serum took over manufacturing the new vaccine and spent 2 years developing a new, reliable method to produce it at scale. For the vaccine's first real-world test, the team chose the West African country Burkina Faso, where around half of the population gets malaria each year. In 2019, 450 young children were vaccinated and found the new vaccine to be 77% effective, a result as strong as they possibly could have hoped for. But remember, this is a long process. Even though the results had exceeded the WHO's goal of 75% efficacy, the team would need more data from a larger clinical trial. This next trial, known as Phase 3, would need to be big enough to determine if the new vaccine could safely prevent malaria in thousands of children. Again, the goal for such a large trial is to make sure that the vaccine is both effective and safe. It's a regular but intensive process in vaccine development. And this Phase 3 trial would cost around $20 million. Nova and Nova Remix are supported by Carlisle Companies, a manufacturer of innovative building envelope systems. With buildings responsible for over a third of total energy use and energy demand on the rise, Carlisle's mission is to meet the challenge head-on. Carlisle's advanced, energy-efficient, and labor-saving solutions can help reduce strain on the grid. Operating nearly 100 manufacturing facilities across North America, Carlisle is dedicated to helping the transition to a smarter, more sustainable future. Learn more at carlisle.com. Nova and Nova Remix are sponsored by Viking Cruises. Ocean voyages, expeditions, river journeys, Viking is dedicated to bringing travelers closer to the destination, offering a small ship experience and a shore excursion in every port. Learn more at viking.com. The R21 team would need about $20 million to produce and test the new vaccine with thousands of participants.
Me and Adrian went almost every door to door and tried to search for the funding. Somebody should support us, and we had really a tough time.
We're fighting for funding against people dealing with other very important medical diseases. People are more likely to try and invest in something that sounds new than the old idea of making a vaccine against malaria, which has failed and failed and failed over decades.
Luckily, the Serum Institute doubled down on its commitment to the new vaccine, R21. In the Phase 3 trial, nearly 5,000 young children received shots. And to more scientifically evaluate the vaccine's efficacy, for every 2 children that received R21, 1 child received a control vaccine. In this case, a vaccine against rabies. This control vaccine looked just like the new vaccine, but offered no protection at all from malaria. Dr. Marine Datu oversaw the clinical study.
The only people that are unblinded are the pharmacy team who prepare the vaccine. The whole idea of this is to not know which vaccine the child has received, to ensure there's no bias. It means that, we will get the most accurate data.
After vaccination, the children were closely monitored for signs of malaria. Success or failure depended on how many malaria cases occurred in the children who received the new malaria vaccine compared to those who received the control vaccine. While they waited for the results, the team also investigated what the vaccine was doing inside the body. For that, they turned their attention to the participants' blood samples.
We can now measure the amount of antibodies that are in the blood. Some of this will be shipped into a reference lab in Oxford, where samples from other sites which are participating will be analyzed.
While the Phase 3 trial would show the new vaccine's effect on a population, the team also needed to record its effects at the cellular level. Back in the lab at Oxford, parasites were added to lab-grown liver cells, along with blood samples from vaccinated children. If the liver cells did not become infected, it would be a good sign that the new vaccine could protect the children too. As Phase 3 proceeded, Ewer and the Oxford team were swamped with samples.
There's absolutely loads still to do. I have a freezer full of thousands of samples from the Phase 3 that we haven't had a chance to start looking at yet. Having had very recently the experience of taking a vaccine through Phase 3 for COVID, where we had an enormous team of people and AstraZeneca working on it, the contrast to the team working on malaria, where there are 7 of us, it's a very different experience. We're under pressure to start churning out some data, so it's full speed ahead.
Phase 3 was the largest study of all and required mountains of careful analysis. A misstep would not only cost years of additional research, it could also require another multi-million-dollar investment.
There's just a lot of pressure to get through all these samples, get the antibody data together. I'm exhausted, I'm tired, I'm stressed, I'm not sleeping. I'm probably not a great person to be around at the moment, if I'm honest.
I'm getting emails at 2 or 3 in the morning, so a lot of people are working super hard.
As the Oxford team neared the phase 3 results, the study's intensity was starting to take its toll.
You know, this is something that we've all worked on for years, so to be this close, it's kind of nauseatingly, sickeningly, anxiety-inducing, really. You know, we just don't know what we're going to see, and I think we'll be all really relieved to get that result.
Finally, the day arrived. Hill and Ewer received the results from the statisticians and found the new vaccine, R21, had improved on the legacy vaccine, RTSS. R21 was 73% effective, a massive leap from RTSS's rate of 40%.
Oh, God, get me a drink. So we have the result of the phase 3. So big moment, as expected from the phase 2. So really interesting results in there. But yeah, really good and really reassuring, and yeah, just very happy.
The R21 vaccine was effective, and perhaps more importantly, it could be considered safe. To determine its safety, clinicians also monitored participants for any serious medical event during the trial, whether it seemed to be related to the vaccine or not. In the phase 3 trial, only 2.7% of participants who received the vaccine suffered a serious medical event of any kind. Scientists then compared that to the 2.5% of participants who received the control, not the R21 vaccine, but also suffered a serious medical event. The difference was minor enough to consider the vaccine safe.
Yeah, we're very happy. Although it probably doesn't look like it, but yeah, it's just a moment that we've been waiting for so long.
You know, seeing the numbers, that was a moment of excitement. Everybody was taken aback and say, you know what, wow, this is real. This is something.
We know our vaccine works. We know we have good data. I'm excited to see the response. I hope everyone is excited as we are.
So here we are on Sunday. On Wednesday, we're going to try and tell the world about what we found.
It's important to remember that R21 and RTSS were studied separately. This means their efficacy rates were determined through different studies and clinical trials of different sizes. So scientists don't like to directly compare them. Still, the Oxford team was relieved. R21's 73% efficacy rate could be a huge step forward in the battle to beat malaria. But a vaccine can only be effective if it gets the approval and backing of governments, and ultimately, wide distribution. If it doesn't get all that, it doesn't save lives. So the Oxford team and their international partners gathered to share the news and present their data for the first time at a global medical conference in Seattle.
I'm very pleased today to be able to share with you the first data on the safety and efficacy of R21 Matrix M, a new malaria vaccine.
The news was received very well. For the team, sharing their results was a moment to savor. Again, the new vaccine couldn't be directly compared with the legacy vaccine. Technically, their trials were different. But a jump from 40% to 73% was self-evident. There was one final step: evaluation by the World Health Organization. Its approval was essential. Without it, donor funds couldn't be used for the vaccine's rollout across Africa. It's yet another process that can take years. But a breakthrough would come only 6 months later.
Day of pure elation for Ghana, for science, and for all of humanity, as the FDA has granted approval to a new vaccine.
Ghana's government has become the first in the world to clear the rollout of malaria vaccine, R21.
Ghana's own drug regulator had reviewed the data on the new vaccine and approved it for use ahead of the WHO. This signaled a clear and urgent demand for this new vaccine. Days later, Nigeria and Angola followed suit. The support of these countries was encouraging for the R21 team, but the world was waiting for an answer from the WHO, the global authority on vaccine efficacy. Then, Adar Poonawalla, the CEO of the Serum Institute, made another bold decision. With Ghana, Nigeria, and Angola on board, Poonawalla chose to not only manufacture vaccines for those countries, but a large surplus in anticipation of the WHO's decision, a total of 30 million vaccines. On the one hand, his decision would make sure vaccines were available sooner and save more lives. On the other hand, it was an expensive risk since the vaccines could expire as they waited for approval.
We've taken all the risk, for the trials, for manufacturing 30 million doses. We just hope that it's all worth it. I wouldn't have the freedom to make these sort of risky decisions and bets had I been accountable to multiple stakeholders, shareholders, banks, etc. Here it's just a few people coming together and quickly deciding to go ahead on something. Everything is now on WHO to approve the vaccine. That's all we're waiting for, and then we can roll it out.
Another 5 months passed, and at last, there was an announcement from the World Health Organization.
Good morning, good afternoon, and good evening. Today, it gives me great pleasure to announce that WHO is recommending a second vaccine called R21-M to prevent malaria in children at risk of the disease.
The WHO approved the new vaccine, R21, for use in any African child at risk of malaria, a decision that would trigger the release of critical donor funds. Needless to say, the Oxford team and scientists around the world were thrilled.
We're not talking about hundreds or thousands, but over time, well over a million lives saved is just staggering and hugely gratifying. And you just feel, wow.
Really happy, really relieved and, proud that we've got here. This opens the door for the next stage for the vaccine, which is to get out there into the real world. And that's the bit that I'm sort of most excited about, really.
And with the release of R21, the battle to beat malaria had marked another important milestone. Long-term, effective malaria vaccines could save a lot of lives, especially if those vaccines can get to the children that need them most. In 2025, the US withdrew funding of USAID, causing a disruption in that support. At the time of this recording, this makes the future of the battle against malaria very unclear. With climate change driving rainfall and increased temperatures in some regions, the landscape of malaria continues to evolve. If vaccines continue to be improved, produced at a large scale, and administered to communities, then one day, malaria could follow smallpox into the history books. This has been an episode of Nova Remix. Subscribe for more episodes and drop us a comment with your thoughts or questions wherever you get your podcasts. And if you want to learn more about malaria and vaccine development, check out the documentary Battle to Beat Malaria on Nova's website and the PBS app. Nova Remix is a series from GBH and Nova, and it's distributed by PRX. Executive producers are Julia Court and Chris Schmidt, and Senior Director of Digital Media is Nadia Petchek-Rawls. Devin Maverick Robbins is Managing Producer of Podcasts for GBH. This episode was produced by Chris Neighbors with sound design by David Porter. I'm Caitlin Sachs.